Welcome to Today's View, the podcast where Elton and Amrinder take a fresh look at the issues that matter to all of us. From politics to culture, from technology to wellness, our hosts bring their unique perspectives and expertise to the table, sparking lively conversations that will keep you engaged and informed. Whether you're listening on your daily commute or watching on our YouTube channel, Today's View is your go-to source for insightful commentary on the latest developments shaping our world. So join us as we explore the big questions and uncover the hidden truths behind the headlines. Don't forget to subscribe to our podcast on your favorite platform and follow us on social media for updates and behind-the-scenes content. Thanks for tuning in, and let's get started with Today's View.
Hey everyone, welcome back to Today's View. I'm Elton.
I'm Amrinder.
Yeah, welcome guys. And today we're going to talk about a really big topic that's been going under the radar there. And we're talking about mental health that affects basically almost everybody here. Apparently 1 in 5 Canadians affected every day with mental health. Yeah.
The other stats are that we need to look at, which are staggering, is by the time Canadians reach 40 years of age, 1 in 2 have had a mental illness. So it's quite a big topic. Even young people aged 15, 24 are more likely to experience mental illness and or substance use disorders than any other age group. And 39% of Ontario high school students indicate a moderate to serious level of psychological distress. Right, so it's quite a serious topic, and this is one of those topics where not a lot of we don't talk about it when it comes to talking to friends, when it comes to talking to families.
Yeah.
This is one of those topics where everybody feels uncomfortable talking about, right?
Yeah, so. and we got these stats from camedge.com, so it's the mental health facilities within Canada, and they're pretty good, reliable stats that you can find there. It's pretty shocking once you go through all these stats. It's crazy how underfunded mental health is, and how sometimes we're not even taking care of people with mental health. We're downplaying things, or we're not taking them as serious as it could be.
Yeah, it's if we don't do it, if we don't take care of this, it's a slow bleed that's only going to get worse. So this is going to cost us more upfront, but if we don't take care of this, it'll cost a lot more, and it's going to keep costing us a lot more. It's going to keep getting worse. So today we'll talk about what we think, why it's happening, and what are some of the solutions that we see that we can think of. Yeah. And obviously feel free to leave some comments and give us feedback in terms of what you think. But we'll start off with in terms of why do you think this is happening? Why do you think mental health is on the rise?
I feel like we have so many things that's affecting us, and I'm pretty sure social media plays a really big role.
That is a big role. A lot of people are not interacting face to face, and they're going online, and they're seeing and some overuse of social media, overuse of phone and tablets and computers, and where we're not going outside, we're not having those discussions, we're not doing a lot of physical activity, and looking at other people, and everybody posts fake stuff online, right?
Yeah, and the problem is, it's the fake stuff there, and the bullying that happens online. If you don't agree with a certain comment, right? People able to dox you, they're able to find your information and just harass you on and off.
That especially with teens, that's a big thing. Is a lot of bullying, a lot of harassment online. And so social media is playing a big part of this, which wasn't there in the past.
For us, not to sound like we're old, right? But
when we were
nowadays.
teens, we had the flip phones or something, so it was barely playing the snake game and whatnot. So it wasn't,
and we didn't even have Facebook or whatnot.
Facebook was just starting as we were in college, so it was it was its infancy stages, and I remember opening an account and then closing it right away because I saw how bad it can be, how toxic it can be, right? So when I still don't have a lot of social media accounts, I'm not on TikTok, and I think you're not either. We have Facebook, obviously, to stay in touch with the family and friends, and I use it for business. But otherwise, we try to not to go on these social media websites. Almost like
and that's unfortunate for teenagers. This is their new reality.
Yeah.
They have to deal with the internet, which is dealing with more people than what we were dealing with, right? So that's what kids are dealing with. And for adults, I feel like we're dealing with inflation costs. We're dealing with housing crisis. We're dealing
Affordability
Yeah.
and workload as well.
Yeah.
I know a lot of people that have two jobs because one job is not getting them by. They're either doing a job, full-time job, or a part-time job, or a full-time job, two full-time jobs, or full-time job and or a side hustle. Where as before, one person was able to work, be the breadwinner, and you were able to afford a house. Now it's almost like everybody's got to work, and on top of that, you're not able to save enough. Like, as I said, especially in area like Toronto and whatnot, real estate is so expensive that affording a house is sometimes out of reach for most Canadians, right? So
yeah. Compared to 30, 40 years ago, a
yeah.
one-person job or
Yeah.
a single family with one person working could afford a house, and
afford a
now
house.
it's like both partners have to work to get
and they
this.
still can't afford a house, and and sometimes if you're paying like a babysitter, if you have kids, then you're breaking even. So the savings is going down, the debt is going up. So that's to do with it, right?
Yeah, and it's a lot of things there. Like obviously inflation, food costs,
Yeah.
the wages not matching inflation.
Agreed. Agreed.
And when you're always under the threat of losing your house, that causes social
The
anxiety.
stress that causes stress,
Yeah.
and the stress is probably through the roof. Based on previous generations, in terms of working today and being out there to be able to afford things.
Yeah. And also sometimes people don't support each other. Like, I feel like sometimes with certain generations, mental health is not taken seriously.
Yeah.
And
Yeah.
they just play it down and say, "Oh, it's whatever. You
Yeah,
toughen up, right?"
Yeah, there's been some friends who been going through this, and they shared theirs about they just can't get through their family members, and if they do try to talk to them, it's downplayed or not talked about,
Yeah.
or say just pray a little bit more, or just do the right thing, or do this. There's no listening aspect of it. There's
Yeah.
no sitting down. So that's why a lot of people are not communicating with each other. And that's having a big factor
Because
as well.
certain cultures do view it as taboo to talk about health crisis, right? And they're like,
And it shouldn't be. It shouldn't be. Yeah. Yes, it is. It shouldn't be. And that's where we're trying to get the message out there that, if you're suffering through this, if you are, talk to somebody, whoever you feel comfortable with, whether it be a friend, whether it be a family member, whether it be, colleague, whoever, talking about it helps.
Yeah. And that's why Bell has done a pretty good job with Let's Talk campaign.
Yep.
Obviously, it's raised awareness of mental health, but I still feel like there's more to be done. Because
more to be done. Yeah.
not dealing with
100%.
mental health is like a slow bleed, right? Because we are dealing with issues where if you're not taken care of, it does affect other aspects of life. For instance, they are taken to facilities that don't deal with mental health. They're taken to hospitals where they're not equipped with that, and they're taking up ER beds sometimes.
Yeah, which it brings out to the next discussion is not enough facilities or staff or doctors, psychiatrists, and everything to be able to deal with this. So,
Exactly.
There was a family member who had who's going through something. We went to the hospital, and they're like, because it's on the fence, we can't really do anything and go see psychiatrists. We try to book an appointment with a psychiatrist, and there's a backlog.
Yeah.
And then on top of you suffering from this, there's some that are available that you have to pay for.
Yeah.
So imagine if you're going through a tough time and you don't have the money, what do you do? So
Exactly.
the system loses you fall through the cracks.
Yeah. So it's just like our normal healthcare where we're short on staff, we're short on facilities. We need more funding for actual psychiatrists and whatnot.
Yep.
And just like how we normalize doing basic health checks every year, we should do it for psychiatric needs as well. Because if this goes unchecked, then people go into alcohol, they deal with drugs. That's substance abuse that you don't need to get involved with. Because once you deal with substance abuse, like let's say alcohol, too much alcohol affects the liver. And then what happens? You go to the hospital, now you need a liver transplant, and there's other people that need liver transplants. You're taking things away from them. Same thing with substance abuse. You overdose on narcotics, you're going into ER, and our ER is already overloaded with things, right? And this is where I blame the producers of these narcotics, where they're just freely made and it's so easily accessible that we should deal with things like that. So yeah, we should be able to get more psychiatrists involved, be able to, deal with things like this. And
Yes, so more facilities are needed to, and because again, if we don't take care of this, it spills over into other areas, right? Healthcare costs go up, and whatnot. So taking care of this will, so what is this costing us, right? What is a cost if we don't take care of this, or we're not taking care of this properly?
Yeah.
And this leads to obviously, people around us that are either going into depression or committing suicide, or so there's a lot of deaths in the family that you hear of, or friends, right?
Yeah.
High rate of consumption, as you said, of alcohol and drugs, right?
Yeah.
And at the end, this is where to take care of this, it's costs going up, right?
Yeah. And as for CAMH, it's costing us $50 billion a year in Canada
So-
to take care of the situation.
Yeah, so it's not a small task, and it's only going up. So and they were talking about how we need to increase it by 9%, 10% or more, because to be able to facilitate or take care of our population. So. But let's talk about some of the solutions. So we talked about why and what the costs are right now if we don't take care of this. But what are some of the solutions you see?
Yeah, I feel like obviously we should try to get our inflation down so that the stress of that's affecting people,
Affordability.
the affordability. Yeah, thank
As
you.
well. A lot of people are stressing over housing. A lot of people are stressing over jobs and overworking. I know there was a talk about a 4-day work week, as being a solution. But
Yeah,
if you do that, it may work for some industries, but some industries won't work,
Yeah.
right?
The culture right now in North America is it's always work, 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 and there's no benefits of or there's
There's no
no
reward, right? Like, is it to say you earned,
Yeah.
you worked hard, and there should be a reward, right? So,
yeah, and there's no balance, right? We're always working just to pay our bills. There's no other balance to of your home life, right? So if we can change that, yes, some industries might not be able to go to 4-day work week, but I feel like it can be done, right? And apparently the studies done in Europe where it shows productivity actually went up, right? It might not seem a lot, but it actually did go up
Does it-
where you
does
have
it help,
4 work weeks, right?
And that's another thing we can look at Europe, because in Europe the lifestyle is different, and it seems like the people over there are a bit happier or enjoying life a little bit more, and that comes down to spending more. But at the same time, we can't just have 4-day work weeks, and then the 3 days we have we're sitting around and sitting on our devices. So
Yeah,
there needs to be
there has to be a balance, right?
Yeah,
And
exactly.
especially here for us in Canada, and here in Ontario. Yeah, we can enjoy the outdoors during the summer months, fall months, but
Yeah.
winter you're kind of stuck at
Yeah,
home.
you're
But
kinda stuck,
there
yeah.
should be some kind of programs where after school program or after whatever program where you're just keeping your mind at ease and you're keeping it busy and doing stuff, right?
Yeah, so more physical activities, especially for kids, teens, adults, even after school programs, sports. That's what we need to involve our especially in the summer. Like, my kids are going to be sitting are going to be home. Let's say, what are they going to do? They're going to be on the devices,
Yeah.
right? Unless we put them in swimming classes and other stuff.
Yeah.
And this is where not everybody can afford that, and this is where we run into challenges, right?
Yeah.
Where we can't afford it, so we just keep our
Yeah.
kids home, right?
Yeah, so if we were to break down between the age groups, obviously for kids, we should limit their social media, how much they go on the internet.
Yes.
Till they reach a certain age, and there should be education in schools about social media, because you got to teach about harassment, bullying, and
Yes.
sometimes sexual predators, which the kids unfortunately have to deal with,
Yep.
right?
Yep.
So kids at certain age have to be taught that.
Yeah, and also, like, for my at my house, I have Google Wi-Fi where I actually control it from this
Yeah.
time to this time. I have a schedule.
Yeah,
Turn it off this time, and if the kids have been bad, I just push a button and it disables their Wi-Fi, and
Yeah.
then they're running down. Sometimes I have to do that in case when it's lunchtime or dinner time, they don't come down.
yeah,
So it's one of those things where you have to have control, and a lot of parents may not know this. So
Yeah.
going online and looking at some of the ways where we can control some of the content and limiting, even on the Android tablets or Apple,
Yeah, for sure.
Apple ecosystem, you can limit it. Like, for my daughter, I've limited to, like, whatever, 2-3 hours, and then it just pauses the device, and then
Yeah.
I have to give it either a bonus time if it's a weekend or whatever, a day off, or I can say give a bonus time, or she can request it from me. So these are some of the things. So limitations on some especially social media or online content
Yeah.
is key. Yep.
And even for like if we stay with the same age group, yeah, the after school programs will help. Sometimes some kids don't have good homes, right? There's something wrong there. Like,
domestic violence, whatever the case may be.
So if we can have more after school programs, and I know in Ontario we actually cut that because Ford decided to cut a lot of things there. But if we have after school programs that can cater to children's needs and help them with certain things, I feel like that will help in the long run, especially in very, certain neighborhoods that are not well taken care of, right? And that's where the crimes are and whatnot.
So one thing I remember, I was watching an online documentary. I can't remember what country. I think Finland or something, where they actually got kids to do less schooling, like in terms of hours, than here, North America.
Yeah.
They only go for a few hours a day, and there's no homework, there's no tests, and the kids are actually better off in terms of when they've reached, teens or adulthood.
Yeah.
Whereas here, and I noticed that difference too. When I used to live in Brampton, it was a lot of academic push in schools, academic. Not a lot of physical activities and whatnot. And since we've moved over to Halton, the kids have been going into school and they've been doing a lot of physical activities, such as going to the grocery store or, doing this, doing that, and Habitat Center. And my kid who was struggling, my son who was struggling in the Brampton schooling system, he's doing a lot better at the Halton system. We came from a zero to hero, and he has a lot more friends. He's doing a lot of physical activities. I think that's important as well. Along with, so you can't just push academic on kids and push, because that comes to a point where it does affect their mental health. So a lot of,
especially if you look at the Asian countries like Japan, South Korea, they were pushing for so much academic programs, but the kids were suffering. There was a higher rate of suicide, and that's the same thing with where we're from, India, and especially here in North America and Canada. Our Indian culture is pushing people like you must overachieve so that you can do better in life. But where's the enjoyment, right? So
exactly.
There should be a balance of, like you said, physical activity or something that's not always putting pressure on them to always overperform.
As parents, yes, we can, instead of just looking at what we want our kids to be, look at what do they want, what do they excel at. Give them a few sports to try. Don't just go back with what you think is right for your kid. Have them try a few things, see what they like, and and let them do what they enjoy as well. Because a good saying is if you love what you do, you never work a day in your life, right? So
and it's good to start at a young age with this, because if you don't start taking care of this at a young age, then it does cause issue, which goes up to other age groups. And this is where we start talking about from teens to young adults, where international students coming to Ontario, there have been a high rate of suicides amongst them because they're not doing well in their classes, as well as not even getting enough jobs here to help support their family, right? So we've had issues where the rate of suicides have been up this year.
So there's a lot Indian of students coming from from a lot of other countries, and they come here, and there's a lot of pressure because back home they've sold a lot of, or they put us, they've sold their land. They've taken on a lot of burden, interest, whatever the case may be, to get a loan to come here. And now they have to. It's good that the government kind of increased from 20 hours. There used to be a limit they can work more a little bit, so they can offset that cost, which is good, because there was a lot of exploitation that was happening. A lot of people were working in cash, and a lot of workers were using that to their advantage and not paying them and everything. So that's a good thing. But at the same time, they have a lot of burden as soon as they land. One is studies, and then second is they have to support themselves, and sometimes even send money back home to pay off some of the interest and whatnot.
There's a lot of exploitation happening where they're coming from, because like you said, they are pressured to get loans. Their family members pressured to get loans at higher interest rates, and sometimes you have to go through shark loans or crazy gangsters, right?
Or sell off land or wherever the case may be, right? You put everything on the line, right? So that's another thing that's big, and we've seen that some of these kids are either disappearing. You find them in parks where they're in really bad condition. They're living in parks or wherever. They stop talking to they just go silent on all over with their family and friends. So
and this is the problem with which I feel like I came here as an international student, and I feel like certain colleges and universities are getting better, but they're in it for the money because they're charging 4 or 5 times more for an international student compared to a
they do
regular
pay.
student,
The
right?
fees are really high.
Yeah, and I remember I used to pay $6,000 per semester, whereas you were paying 1.5.
Yeah.
Right.
Yep,
So I can just imagine this was back in 2003, and now it's 2023, so
Yeah,
it's probably more.
it's a lot more.
The problem is when you are bringing on international students, yes, they do have some kind of programs to intermingle with other international students, but how do you keep check of their mental health? You're just looking at their grades and that's it, and you're looking at their money. So sometimes certain universities just, you're here, you're surviving, that's fine. I don't need to check up on you.
Yeah.
Which they should take more care into taking care of these students because,
Indeed.
at the end of the day, they're human beings, right?
Yeah, and the other thing is, along with that, is we're getting a lot of students to come here, but then there's no facility set up for them to stay at. There's no boarding. So
They do, but the problem is it's even more expensive.
Exactly.
So I'll use my example. I was paying whatever for per semester,
yeah,
but it was the same amount to go into a boarding.
yeah,
So another 5 to 6 grand.
yeah.
But that doesn't include food, which I would have to pay separately, which is another $300 to $400 a month.
But what I see is a lot of especially around Sheridan College and other colleges, Humber College and whatnot, the rental prices are so crazy that a lot of people are posting pictures of shared rooms and everything, and some of these are not even legal basements, or they're a hazard. And I saw one the other day too, shared room for $700-800 where you have to share a room with somebody. It's and when you live in a state like that where you're sleeping on the floor on a mattress, wherever the case may be, and there's some of these basements are really unfinished or really in bad condition, your mental health has an effect, right? Like a study was done whether you sleep on a floor where there's windows and stuff, and then you sleep in a basement, and that could also have an effect where you have no light or anything, and it feels like you're living underground, right? So
and this is unfortunate. Like why, as we the people, like just letting things happen like this? Why are we being so greedy and just taking advantage of these students, right? I know there's one basement, there was like 14 people living in there, and they're paying like $800 per people, right? And
exactly.
that shows how petty and greedy we as society has become, because
it's
obviously people will say we have to pay our taxes and all that, but do you really need 14 to 15 people to live there?
Live in
right?
one house,
and this is I blame us partially, and I also blame the government, because you're making housing go up with pricing.
Exactly. Right? If there's not, like, beside a university or something, there should be some accommodation, right? If we can build beside a GO station, we're building these parking floors where we can park our vehicles. Same thing beside colleges, university, there should be cheaper accommodations going up.
Yeah,
right?
and this is where the universities are taking advantage, right?
Yep.
So for me, I went to Humber College. Again, like I said, per semester, 5.5 or 6 grand. And same thing for the dorm. And the dorm was actually smaller than what we are in this room here. Right? It was small. It didn't provide internet, no TV. It was just like, think of it as a cell, but it had doors. The washrooms were shared. You didn't have your own private washroom. Bed was provided. So in the food, you had to get a food card, which was $300-400 a month, not per semester. Wow. Right? So you're taking advantage of international students and even students that come from out of province, because they have to pay similar pricing. Obviously, for the semester, they pay less because they're Canadians. But, why are you charging more for all this? And this is what causes stress for students, international students that come here. Their mental health really takes a dive because your parents, because you feel guilty. Your parents are paying all this and you have to achieve, because if you fail, what happens then, right? Like, you're forced to take the shame of not passing your grades and not dealing with things like that. And it's crazy how money is being sent back. They have to work, so there has to be a balance between work and studying. Sometimes you work 20-30 hours a week, and then you got to study, and if you don't pass, there's a chance that you might have to go back to where you came from, because that's how strict the colleges and universities are. If you don't have a passing grade, you have to go back. Right?
So that's something that's a huge toll right now. I know, and it keeps getting worse and worse. Like for international students, as they're coming by the numbers, it's this greed system. Some of these universities or colleges are not even proper. They're running out of like a floor or a unit or something. And the other time they especially during COVID, there was online classes, so these colleges were bringing thousands and thousands of students where they only have the capacity to have a few hundred in the classroom, right? So
Yeah.
that's where greed comes in. This is where the government needs to check in: are these facilities proper? Where are the housing nearby before we start bringing them over?
Yeah, and especially if this stuff could be done online, why can't we do it online with the studies, right?
Yep.
Especially when COVID hit, all these universities and colleges, they were charging the same. Why? We're not using your facility. You're just going through the online, right?
Yeah, exactly.
Right?
Maybe there should be a cheaper option for online only.
Yeah, and try to reduce the burden on people. Like, why are you charging the same, let's say, 5-6 grand per semester for international students? Because some of the international students were actually studying from back home,
Yeah.
right?
Yep,
They were not even here, right? And if that could be done, why can't we just do that? Right?
Yep.
Make your money off those people. Let them have the less burden than coming here, because some people cannot adapt if they're not socialized well back home. They come here, they're by themselves. They don't have that support. They don't have a family member they can talk to.
Yep.
Maybe they're very shy in talking to other people, right? If you're sociable, yeah, you can kind of get better at things. But if you're not talking to people, your mental health really just go downhill.
Yeah, which brings us to the next topic is this work from home that came up during COVID as well. And obviously these kids, they were studying, and I can speak for myself, my kids were struggling studying when they were at home, right? Classes were online. They literally, we have 3 kids. You can't sit down with each kid and be able to put them in front of, especially at an age where they're 10 years old or younger. It's hard to do that, right? So I think kids during COVID had suffered a bit from their academic and studies and socializing with other kids, right? So that was one. And let's talk about adults, right? When there was work from home, there still is some companies, and there's a big right now amongst the bigger companies like Google, Facebook, and all that, or Tesla, where a lot of people are comfortable now working from home. They've upsized the house, or they've dedicated a room where they can work from home, and they're comfortable now. They're saying, I don't want to go back, this is where you got to look at costs and everything, and it's coming into play. But at the same time, on the other end, companies see a productivity decrease. You can't do it with every job. Obviously, there's certain jobs that you can do, like developers and whatnot. They can work from home. There's certain jobs you just can't, and we've seen sometimes some companies or company owners saying, listen, they're not as productive, right? And also the health aspect of it, the mental health aspect of it. When you're not interacting with a lot of people, you're sitting in one room. That's also can have a bad effect on you.
I think it depends on a case by case with adults, right? So obviously, when COVID hit, it showed a lot of people working from home what a difference it makes. Especially commuting from, let's say, from Mississauga to Toronto, being stuck on the highway, that causes stress, right?
Mental health.
That causes so much stress because, hey, I'm going to be late for work. Can I find parking? But, even dealing with that, it was like dealing with traffic, dealing with parking, but also waking up early to go for a job, right? Let's say your job starts at 6 a.m., but you probably might have to wake up at 4 or 5 a.m., right? But now that you work from home, hey, I don't have to wake up so early, right? So there's a lot of things.
There's trade-offs. So
and people realize, like, I don't even have to stay in a condo, which was overpriced in Toronto. And that's why you saw a big push of people going out to the suburbs and,
purchasing, bigger properties.
And that's why some office spaces are left empty now. So it's a case-by-case basis. Some people can work from home, some cannot. And this is where you should have a good manager to discipline people, to help them improve or not improve, right? Because if they're not working well from home, then obviously you make them work from the office. And this was a big issue where we had that strike with the CRA. The main issue was working from home, because some people were working from home and that's what they were hired for. And then the CRA was trying to push that and say, no, come to work for office now. Right, it's because they have.
So there's pros and cons, especially dealing with sitting through traffic and going through like road rage and everything. There's a lot of people who could benefit from that, who are doing 1.5 hours or 2 hours, sometimes a commute per day, each way. They can benefit, get that time back. So, but it all depends on the work. Industry depends on the job. It depends on. There's a lot of factors, but that's some things we can look at, right? So that's key.
And with adults now, they have the issue of now, can they afford their mortgage? This is where their mental health is taking a dive, right? Can they afford food for their families, right? can they afford a car? If they can't afford a car, they have to rely on this outdated transit system that has to take them from place to place, right?
Yep.
Now, if they can't afford food, it's because of inflation,
Yep.
right?
Yep.
And what is the government doing? Nothing. They're not reducing the inflation. Look at Loblaws. The CEO was there saying, "Hey, we made this money, but it's not because of us. It's what the farmers charged us," right?
So they benefited the most. Truckers didn't benefit.
They try to blame it on gas prices,
Yeah, exactly.
which is not right.
So then, at the same time, trucking industry is suffering. They're not getting these profits. If anything, they're suffering. We deal with a lot of truckers in our field of work, and they tell us they're struggling. So they're not getting the benefits. Who's getting the benefits? It's Loblaws who's profiting the most, and
or
they're
mostly
not
the
passing it
grocery
on.
stores, but
Yeah, exactly.
Loblaws was the biggest example.
Exactly.
And the funny thing was, when he was talking about this, a week later, he gave himself a raise, a $1 million raise. Does a man need $1 million? Why not pay your people that are working minimum wage a proper living wage?
It's greed, right? Corporate greed. We're becoming like the States, and
and what's the government, especially here in Ontario, and I'm pretty sure it's everywhere in Canada, what's the government doing to stop this greed? Right? They're not doing anything.
Some caps, maybe. And whatnot.
Like how, for example, okay, you're saying food prices are high because the farmers are charging high. Okay, especially here in Ontario,
farmers
we need
are not making money.
Yeah, if anything, the farmers are not making enough.
No.
They actually have a limit on how much milk they can produce, right?
Yeah.
We
have to throw away the rest of it, right?
Yeah, so that's... if we get rid of this cap system and produce more milk, sell it internationally, we can make more money, we can reduce the inflation, right? But it's obviously corporate greed that's driving up stuff here. And I feel like we're not taking care of this situation. And this is what causes our mental health to degrade, because we're worried about taking care of our next set of bills, right?
And the next thing I want to talk about is again looking at Europe. They have a really good system. Here it's optional. A lot of first of all, most people don't even have a family doctor. So going to a family doctor for annual checkup is out of the question. But they have doctors and assigned and everything, and they do an annual check on you and to make sure everything is good. It's almost mandatory. And then the other thing that we can maybe look at is doing like a mandatory health check. If 1 in 2 Canadians are going to suffer at the age of 40, maybe why not? And we do that with prostate cancer and we have other testing. Why not introduce some around that age group? Is we have to go see a doctor and you have to get a health checkup and whatnot, right? So I think we need to work on that as well. The other thing I want to talk about is updating some of the laws, because there are some laws that are outdated. And if somebody does this, they go to jail. Instead of putting them in jail, maybe we can put them, especially if it's mental health related and whatnot, or caused by that, let's put them in some programs, right? And we've seen where mobile crisis team is what we call them. They reduce about 70%, in reduction in terms of cases happening again, right? So the other thing we can do is probably looking at training our police force a little bit to better respond, right, to health issues. Because we've heard of those stories where, especially in Canada and New York and whatnot, where the way the police dealt with some of these situations, it could have ended differently had there been a crisis team or someone else or better police who are better able to equipped to better handle these situations.
So mobile crisis teams here in Canada is basically a police force with a PSW or a psychiatrist that respond, but we don't have enough of that.
No.
And the stat that you said, 70% reduction, that was with Hamilton Police. That was 2 years ago, where they said they had a 70% reduction. And you're right. Instead of putting people in jail, like let's say for substance abuse, we should give them a chance to go through rehab. Yes, sometimes you do force them to go to rehab and it doesn't work, but it's not a fast process, right? Especially substance abuse, they're trying to forget something that they dealt with, right? Trauma. They don't want to deal with it, emotionally, and they try to forget it. And how do you forget it? You take alcohol, you take drugs that can help you forget things, and that gives them that high to not remember things. And if it's not dealt with properly, you're just going to keep drinking or taking the substance abuse, right?
Agreed.
So I know some people say, we've given them a chance, we've put them in rehab and it didn't work, but it's not a one-time thing. It's a continuous process, right? Just like how you try to do self-help for yourself or take care of yourself. It's not a one-time thing. Just like how you clean your house, it's not a one-time thing. It's a continuous process, right?
Agreed.
So when we put people in jail for petty things like, oh, this guy had drugs, he was high on drugs, or he was high on alcohol, if it's a one-time thing, okay, sure, like we'll deal with it. But if it's continuous, that means there is some kind of mental health situation going on with this person, right? The other thing is, if you know there's a psychiatric breakdown or psychological breakdown with this person, yeah, we take him to a psychiatrist, not take him to jail or take them to ER.
Just to kind of give you some stats, it's estimated that about 67,000 deaths per year attribute to substance use in Canada. So, and that's alcohol or tobacco or whatever. So, right. So, if we can bring that down, and again, we've set records in terms of, a sale of alcohol in some of these stores and whatnot. We're that's a trend that's going up, and if we can reduce that, where we can, save costs where people are using less drugs and alcohol, and B, reduce the number of deaths at the end, and suicides and whatnot, it'll benefit overall everybody. And
and it comes back to the point where we talked about before, where if they're getting alcohol poisoning or substance abuse and they're overdosing, it takes away beds from ERs and other beds, right? So that cuts down the cost. If we're able to take care of this and deal with this, then it takes care of the situation. And that's where I feel like we should start this at a very young age with kids. That's why we were doing a breakdown with different groups. And right now we're having adults here. We're talking about adults with, paying bills and whatnot. And what about the elderly, right? Sometimes there's elder abuse. Sometimes there's elder neglect where they're just living by themselves. People probably have seen like some houses are getting burnt down because there was like stuff stored in the house, like hoarding situations with older people.
With older people,
this is where we should have a PSW check up on them and deal with that situation, but we don't have enough PSWs.
We don't have enough, man.
Right.
So that's what trend we're seeing in Canada. There's not enough.
There's not enough. It's more about making more money off people's backs and not taking care of the situation. And that's funny because corporates should realize once people start dying and there's not enough people, you don't have your money to make any more. So they should be smart about this.
You need a healthy and happy population. Otherwise, you will suffer. And we need, especially to take care of the baby boomer population that's coming, and there's less. We need people who are healthy, who are fit to be able to take care of the other, the elders, right? So, and the mentally ill. So, I think we'll leave it at that. There's a lot of talking points that we covered. Please feel free to share your feedback. And if you are going through anything with mental health, please talk to somebody. I know it may not be a perfect system right now where you can, if it's serious, obviously, seek immediate emergency services. But if you're not, starts with having a conversation. How you're feeling, what's going on at home with your colleagues, with your friends, with your whoever you're comfortable with, family member. Talk to your mom and dad. Talk to how you're feeling. I think getting those out there is key. And again, we all need to pull together and get through it together.
Yeah, for sure. And basically, like he said, if you're dealing with things, talk to someone. If you don't have someone to talk to, there's always programs out there. There's helplines that you can reach out to. Each province here has different phone numbers that you can reach out to. Just Google it. There's always someone willing to talk to you. Again, you're not alone. There's people out there that's willing to help each other out. This world is not always for themselves. There's actually people helping each other out.
Great people out there. Just got to reach out to the right person.
Yeah.
And in your circle there will be somebody. And if there's not, as I said, there are facilities, but try to reach out to somebody. Try to communicate.
And if you feel like you can't, then just reach out to us. We'll talk to you guys too.
We'll love to talk to anybody about anything, right? So we'll leave it at that. Thank you so much for joining us and listening through this, and we look forward to on the next one.
Yeah, thanks guys. Thanks for watching us. And if you want to follow us along, make sure to like and subscribe on YouTube here. Or you can go to todaysview.ca and find the podcast that you're into with your own streaming service, either Spotify or Apple, whichever you prefer. We're all over there. Make sure to subscribe, and thanks for the feedback. We appreciate you guys talking to us about that. And see you on the next one, guys. Have a good one.
All right, take care.
See ya.
Thanks for tuning in to today's View. We hope you enjoyed the conversation and gained some valuable insights from our discussion. If you have any thoughts or feedback on today's episode, we'd love to hear from you. Reach out to us on social media or leave a comment on our YouTube channel. And don't forget to subscribe to our podcast so you never miss an episode. We'll be back next week with more engaging topics and thought-provoking analysis. Until then, stay curious and keep exploring the world around you. This has been today's View, and we'll talk to you soon.